there are requirements that are needed for this bed to be made. And before us there is a trolley with requirements, and on the top shelf we have a long Macintosh, we have a bottom sheet, and then we have 2 pink sheets. These are our infectious sheets, and we have chosen the color pink so that we are able to identify this color. However, if you're in the hospital, you can label the bed sheets that they are for infectious patients. Then we have a draw Macintosh, a draw sheet. We have a top sheet, a blanket, and a counter pin. Then at the bottom shelf we have a pillow, just for the patient's comfort. So at the side we need quite a number of requirements, and first we have a gown on the hanger. So these gowns, we're going to use them for protecting ourselves. So when you are going into the room for an infectious patient, you need to protect yourself. You need a screen, of course, and this screen is there in case we don't have an isolation room. So for patients who are infected or patients with infectious conditions, they need to be admitted in an isolation room. But for settings that do not have these rooms, we put them in a corner and then screen them to separate them from the rest of the patients to prevent cross-contamination. And all these requirements must be in the patient's room, only used by the particular patient. So we need a tray and the feeding utensils. So here we have a spoon and we have a plate, cup, made for that patient. So still, as part of infection prevention, you need face shields. These are face shields, and also we need face masks to protect ourselves. We can have a cap to protect our hair, and then we need a tray for vital observations. So as you can see, to take the patient's vitals. So we need gloves. These are sterile gloves, and we have clean gloves for our personal protection, and this should not leave the patient's corner or the patient's room. We need sanitizer to sanitize when we do different procedures in that room, and also we need a hand washing facility. Then we need a bedpan for the patient to help himself. So our 2 chairs as usual for stripping the bed, and then we need buckets with disinfectant, and this can be 2 to 3 buckets in the patient's room for decontamination, because every item that comes from the patient is infected. So those are requirements for bed making of a bed for an infectious patient. But we also have to note that this bed is a continuation. It's like an admission bed that we looked at before. But for our case, this time we're going to use pink sheets that we have labeled as infectious bed sheets. So because we need the rules for bed making, I need an assistant, and Sister Safina is going to be my assistant. And then we need to stand in the middle of the bed. Thank you so much. So before we start making this bed, we are going to wash our hands and allow us to use the alcohol rub. So because we are going to make a bed for an infectious patient, we are going to protect ourselves, and Sister is going to put on a gown, and I'm also going to put on the gown. we are set. We are going to put down the rails. Pull the bed away from the wall. And then we are going to check the firmness of the bed. Turn the mattress. Then straighten the mattress cover. Get our long Macintosh. Get our bottle sheet. So as you're making this bed, you make it as for an unoccupied bed. Macintosh. So we're going to get the first bottom infectious bed sheets. So remember, we only meter the bottom. Going to meet at the bottom. So we're going to top sheet, we're going to fold it in the middle. So we still have a print. A white top sheet. So our patient will be admitted in the middle of the pink sheets. Then we get our blankets. bottom sheets are all knitted, both at the top and the bottom. So you can now put your pillow, and then we have our counter pen. And that is a bed for an infectious patient. So now, after making the bed, we need to remove our protective gears and then discard.